Good evening, everyone. Welcome to our webinar, Don't Wait, Vaccinate. What's the difference between the vaccines and why you should get a COVID-19 vaccine? I'm Robin Merrick here with Southern University. Very glad that you all are joining us this evening. Just a couple of opening remarks and housekeeping. We will be taking questions in the chat box as we move forward with our panel discussion. We have an awesome panel for you this evening and an awesome moderator as well to take us through the course of our discussion this evening. I'd like to now turn it over to bring greetings on behalf of the Southern University system, Dr. Orlando McMeans, who serves as Chancellor of the Southern University Agricultural Research and Extension Center, and also Dean of the College of Agricultural, Family and Consumer Sciences. Dr. McMeans.
Thank you, Dr. Merrick. Good evening, and it's a pleasure to be with you today. Again, Orlando McMeans, Chancellor of the Ag Center, as well as Dean of the College of Agriculture, Family and Consumer Sciences. I would like to, on behalf of Dr. Ray Belton, President of the Southern University System and also Chancellor of Southern University Baton Rouge, bring greetings to our panelists as well as our attendees for this evening's event, Don't Wait, Vaccinate webinar. Southern University, I'm proud to say, launched a public awareness campaign in late March of this year to encourage vaccination via COVID-19 for our underserved communities and specifically our African American communities. The university has been engaged in supporting COVID-19 efforts since the onset of this pandemic, offering our facilities, our daily COVID-19 testing, hosting food distribution events and drives, as well as vaccination clinics. To date, the university has hosted 4 mass vaccination events that yielded more than 2,000 shots in arms. That is 2,000 shots in arms. I think that is very important and worthy of applause and of the university system as well as its leadership. Earlier this year, the Southern University System Foundation established a new initiative, Black Health, to address health disparities in minority communities. Dr. Sandra Brown, Dean of the SUBR College of Nursing and Allied Health and co-chair of the Louisiana Health Equity Task Force, along with Mr. Al Harrell, CEO of the Southern University Foundation, and Dr. Ronnie Whitfield, Southern University Board of Supervisors member, as well as a local physician, led this initiative. I would like to pause and recognize Dr. Sandra Brown for her leadership, not only in representing Southern University Baton Rouge and Southern University system, but being appointed as co-chair via the governor of Louisiana for our Health Equity Task Force. She has done a phenomenal job, and I know that this is just the beginning of addressing health equity issues in our underserved and minority communities. So I want to make sure I applaud my dean colleague from the College of Nursing and Allied Health. Also, through our Black Health and University Don't Wait, Vaccinate initiatives, we are providing experts to speak at events such as the one tonight, as well as other related events at communities, churches, and other organizations that may be hosting such events. And speaking of partnerships and collaborations, we have partnered with more than 100 entities consisting of faith-based organizations, fraternities and sororities, civil rights organizations, and the Southern University Alumni Federation with its 80+ chapters nationwide. Our next focus will be in rural areas of the state, where we hope to work in conjunction with my area, the Southern University Agricultural Research and Extension Center, specifically our Southern University Extension Program, which has a presence in 32 of our state's 64 parishes. In closing, I was reading an article the other day that asked whether or not historically Black land grant institutions are relevant. And looking at what we've done at Southern University, stopping, pivoting, not only redoing and restructuring our academic programming, but also stopping to look at our mission of research, academics, and outreach, and understanding that it's a mission mandate for us to serve those individuals, entities, and communities that will otherwise be unserved, and to provide those opportunities for individuals who will not otherwise receive them. So my answer to that article that asks, are we relevant? I would say that we are more relevant today than when we were founded in 1880. And I would like to say thank you to all of those individuals who will be participating on the panel, as well as those organizers. So thank you again for attending this important and informational webinar. Thanks.
Thank you, Chancellor McMeans. We really appreciate you being here and joining us this evening, and we look forward to joining with you in the Ag Center to reach our rural areas up next. I really appreciate that. We now want to next hear greetings from our students. We have Mr. Kevin Taylor Jarrell II. He serves as president-elect for the 2021-2022 school year coming up here at Southern University and A&M College. Mr. Taylor Jarrell.
Thanks, Dr. Merritt. Good evening, everyone. I am Kevin Taylor Jarrell II, and I have the pleasure of serving as the 2021-2022 Student of Government Association President for next school year. As a senior, major in finance with a minor in computer science, I'm very glad to see those who have joined us today, well, this evening, as we seek to learn more about the COVID. I will be a part of the team encouraging my fellow students on campus to get vaccinated so that we can get back to the bluff like we all remember. I had the chance to receive the Moderna vaccination, well, my first vaccination on March 23rd and my second dose on April 21st. I can say that the vaccination had went well for me and I only had mild side effects. But for how the vaccination had affected me, I believe that it was well worth it if bringing us a step closer to normalcy. Again, I would like to thank you all for being here today, and I hope to see you a part of future events through our Don't Wait, Vaccinate initiative. Thank you.
Thank you, Mr. Taylor Jarrell. I really appreciate you and looking forward to serving with you as our new SGA president this coming year. Dr. James Gilmore, joining us with the Bayard Group, who is partnered with the university to help us launch this initiative and further it along. I now turn it over to you.
Thank you so much, Dr. Merrick. And I have the privilege of introducing our illustrious panelists. We have a dynamic group of experts who have volunteered their times here this evening to educate and empower the public. Allow me to introduce Dr. Takesha Davis, MD, who is the President and Chief Executive Officer of the New Orleans East Hospital. Thank you, Dr. Davis, for joining us this evening. Allow me to introduce you to Dr. Ebony Price Haywood, MD, serves as the Medical Director at Ochsner Xavier Institute for Health Equity and Research, as well as the Director of Ochsner Primary Care Research Network. Thank you, Dr. Price Haywood, for joining us this evening. Also, we have Dr. Keith Ferdinand, MD. He serves as the Professor of Medicine at Tulane University. Also is the Gerald S. Benerson Chair in Preventive Cardiology. And last but definitely not least, it's a pleasure to introduce our Dean and Professor of the College of Nursing and Allied Health at the Southern University, Dr. Sandra Brown. She is a fellow of the American Academy of Nursing, a fellow of the American Association of Nurse Practitioners, a fellow of the Academy of Nurse Education, a certified nurse educator, and board certified family nurse practitioner. Thank you all so much. We look forward to hearing from you this evening.
Thank you, Dr. Gilmore. Our panelists are internationally known medical experts and noble humanitarians who have dedicated their lives to saving lives. They are also members of the Louisiana COVID-19 Health Equity Task Force appointed by Governor John Bel Edwards. So we thank you for joining us this evening, and we welcome you to the Jaguar Nation. So tonight we are going to have real talk about the vaccines. 2020 is the year that changed the world. The first case of the coronavirus in Louisiana was confirmed on March 9th of 2020. We saw early on that our Black and Brown communities were hit the hardest by this pandemic. So let's fast forward to this year where we now have 3 COVID-19 vaccines approved for emergency use. The biggest concern that seems to be expressed by our citizens has been, are the vaccines safe? Because they were developed so quickly, and why were they developed so quickly? So I'll have Dr. Takesha Davis answer that question because she's done a lot of work with dispelling myths and empowering people with facts about the vaccine. Dr. Davis.
Thank you, Dr. Brown, and welcome Jaguar Nation. Thank you for having us to have some real talk about vaccines. As you mentioned, one of the questions we have gotten early on and consistently is about the safety of the vaccines and why we should trust them when we have for decades been saying it takes years to develop these vaccines. As I have learned by studying the facts, and that's where we want to focus tonight, is that a lot of the components of the vaccines were already in process, in development before the coronavirus pandemic. Our esteemed colleague, Dr. Ferdinand, reminds us that there was work being done around the world by teams that were very diverse on building the building blocks for this vaccine. And I like to talk to our community in language that they understand. So I always use an example of making potato salad. That's what I do for my family's events. That's what I'll be doing for Mother's Day, is making potato salad. And if I have to make the potato salad after I come home from work, it means I have to boil the eggs, I got to boil the potatoes, I got to cut up the seasoning, I got to mix it all together, season it, and it takes a couple of hours. But if I can get someone to help me and do that, and I often use my mother for that help, God bless her, if she can boil those eggs and boil the potato salad and do all of those things before I get home, then it cuts out a lot of time. I didn't skip any steps, and it is just as good as it would be if I had done all the steps myself. That's what happened with the vaccines. Not only were there components being made prior to the coronavirus pandemic, but then because we knew that this was a matter of life and death and a shared risk, not just hurting Black and Brown people, there were a lot of resources that were put in place simultaneously. It did not make any of us, including myself, feel good about anything called warp speed. It wasn't smart to call it warp speed. What we should have said is that there are internationally renowned scientists who are working on this simultaneously to make sure we have a safe vaccine. And we do. We have 3.
Well, thank you, Dr. Davis. I have a whole new appreciation for potato salad with that analogy.
Right. If you can get that help, it makes it so much easier when you get home.
Absolutely. So keeping in line with the vaccines, we have 3 that have been approved. The Moderna, the Pfizer, both of these are what we call messenger RNA vaccines. And then we have the J&J, which is a little bit different. It's an adenovirus vector vaccines. These are fancy words. So we want you all to break it down. What's the difference between the 3 vaccines? And if someone asks you, which one should I get? How would you respond? So Dr. Ebony Price Hayward, can you share some light on the differences between those 3 vaccines?
Yes, thank you, Dr. Brown. And also want to thank Southern University for inviting me to the panel. I'm honored to be on this panel with Dr. Davis and Dr. Ferdinand, two people who I actually admire at a distance. So I just wanted to share that. But in terms of the vaccine and what's the difference between the three, I want to emphasize that there is no live vaccine. None of them contain a live vaccine. So you cannot get the virus from the vaccine. Now, in terms of the Pfizer Moderna versus the J&J, Pfizer and Moderna have what's called a mRNA or messenger RNA, whereas the J&J uses an inactivated virus. Bottom line is the way both of them work is that they instruct the body to make protein that's on the surface of the virus. Once your body has been exposed to that protein, it triggers the immune system to destroy the protein. The immune system then has learned how to recognize the virus and fight it off. The most important part about that is it keeps you, if you've been vaccinated and your immune system has been primed, it helps you keep from getting a severe illness. And when we say severe illness, we're talking about, are you sick enough to be in a hospital? Or are you even sick enough that if you were hospitalized, you might die? All of these vaccines work in such a way to prevent the illness. If you ask me which of the vaccines you should get, I would tell you to get whichever vaccine is available to you. And I'll tell you why. The science that Dr. Davis spoke about, it was done in such a way that it was rigorous, even though it was done it would seem to be fast. All the things that needed to be in place to make sure that this research was done in such a way to protect the safety of people who are participating in it, and also the safety of those of us who have gotten the vaccine, it was done in all the right ways to protect the safety of the study participants. And because they have been proven to reduce the risk of illness, all of them have passed the cutoff by the FDA. I would tell you to get whichever vaccine is available to you. One vaccine, you have to get 2 shots, about 3 or 4 weeks apart. The other one is a one-time shot. After both of those vaccines, within 2 weeks of either the 2 shots for the Moderna or the Pfizer, or the 1 shot for the J&J, you have reached the level of immunity that protects you from severe illness. So again, I just recommend take what's available to you.
Thank you. Thank you so much. There's been a lot of concern and confusion lately about the J&J vaccine and the recent pause of use due to reported cases where a few individuals developed blood clots in the brain. So that pause has been lifted, but it has left many people skeptical about the J&J vaccine. So Dr. Keith C. Ferdinand, you hail from Tulane. Welcome to the Jaguar Nation. You've talked a lot about the J&J vaccine. So can you share the latest updates as it relates to the J&J vaccine and its safety, so we have some clear understanding of where we are with that vaccine?
Sure. I think one of the first things we have to recognize is that the pause was necessary. They had given about 7.9 million shots of the J&J, and they noticed that there were 6 cases of people who had unusual blood clots. And along with these unusual blood clots, they had very low platelets. What they now think, and these were all women between the ages of 18 and 49, that perhaps some people have a reaction to the adenovirus, the vector. It's a cold-like virus that brings the DNA into the cells so that you can make the spikes. We really can't predict that. So next question would be, why would they have a vaccine that causes clots? But remember, I gave you the numbers. It was 1 out of a million. You cannot know when you do a clinical trial something that's that very rare. And we really are not really sure what's the mechanism behind the clots. Here's what I would suggest, especially for persons who are not in a risk. A young woman is probably at more risk than an older woman. Men are probably at somewhat less risk than others. The J&J is, of course, very safe and effective. It's a 1 shot, 1 and done. It's very good for people who are on the move. It's good for people who are experiencing homelessness. It's good for people who really are concerned about allergies, because the J&J does not seem to cause the same level of allergies as some other immunizations. The mRNA vaccines, which is Moderna and Pfizer, don't have the adenovirus and apparently don't give that same type of blood clotting factor. But even the blood clotting factor is still very, very rare. So the FDA, after the pause with the CDC, said, we're going to put it back into use, but we're going to put some caution out there so the individual choice can be made that if you're at high risk, a woman between 18 and 49, you may not want to take this particular vaccine, or you may, it's your choice. There's no prohibition against it. It's not a contraindication. It's something that's in the label now so that a person can make a decision.
Absolutely right. Thank you so very much. We have heard individuals say, I already had COVID-19 virus. I've already had it. So do I really need the vaccine? So should someone who has had COVID-19 get the vaccine, or are they protected from the virus because they've already had the vaccine? And will we need a booster shot in the future? So that's a two-part question, and I'd like you to address that, Dr. Davis, if you will.
Sure, I'll start and I'll give you my opinion. I'd love to hear as well from Dr. Ferdinand and Dr. Price Haywood as well. Absolutely, if you have had COVID, the science shows that you should receive the COVID-19 vaccine because we don't know how long that natural immunity actually lasts. From the data that we've seen thus far and that's been published, it's around 90 days, but that's not uniform. So it is recommended that if you actually have COVID-19, that you receive the COVID-19 vaccine to provide you that additional protection. The only caveat is that if you are diagnosed with COVID and you receive either convalescent plasma or the antibodies for COVID-19, that the recommendation is that you wait at least 90 days before you get vaccinated. But the recommendation is still the same, that you should be vaccinated. However, if you've received one of those treatments, you wait the 90 days because you might have a hyper reaction if you get the vaccine prior to that. So absolutely, yes. Do I think that we will need a booster dose to the vaccines? I believe so. I think that the science is leading us in that direction. If we all think about it, we're only about 8 months out from receiving the vaccines in the general public. And we're already seeing community members who have been fully vaccinated, who are contracting COVID-19. We know that the viruses aren't 100% effective at actually contracting COVID-19, but effective at preventing severe disease. And we have these variants that are continuing to emerge. So I do think that we will need a booster, whether that's at a year, will that be every year? I think the jury is still out, but I think we should be preparing ourselves that we will need to have a booster.
Dr. Ferdinand or Dr.
Dr.
Price?
Brown, I'll give you two areas in the world that have convinced me that natural immunity is not going to be enough. One is Manaus, Brazil, Manaus. It's a town in the Amazon. And most of you know it because I'm going to describe it and you're going to remember it. In April and May of 2020, this was the place in Brazil where there were so many people dying that they had trenches. They dug trenches in the ground and had bulldozers just pushing bodies into the trenches. That was last year. So the people in Brazil said, well, good, we got natural immunity. We've been through heck, but we survived, and now we're going to party and have good fun. Fast forward to 2021, much of that natural immunity worn off, plus they have a variant called P1 that apparently is now able to give a second infection, and Brazil is back to square one. So getting a whole bunch of people sick did not protect the people of Brazil. The other group are the people of India. And those of you who have not taken the time to look at the news on India, please do so. Here you have 300 to 400,000 people getting infected, 3,000 to 4,000 people dying every day. And we don't think it's because India never had COVID-19 prior to today. We think it's because any natural infection they had in the past just is not holding up. Plus, they have their own variants, their own kind of strange coronavirus that's now coming to infect people. So it just does not make good sense for somebody to say, well, I had COVID-19 in April, May, or June of 2020, and I'm protected. The data indicates that, yes, you are protected, as Dr. Davis said, but we don't know how long. Brazil and India suggest that just getting a whole bunch of people sick is not going to get us out of this pandemic.
So I'd like to add a couple of points and maybe focus on the booster and the need for a booster. So several times we've all mentioned the variants that are in the different countries that are out there. And if we step back away from COVID-19 and just think about the flu, right? Because this pandemic is very similar to the flu. We get a shot every year. That shot has different combinations trying to tackle different types of viruses that are circulating that year. Think of if you've ever heard of the survival of the fittest. So the virus is just like us trying to survive. We're fighting it. We're coming up with, all these answers to try to contain it. And the virus is trying to say, no, 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 I want to live just like you. So I'm going to mutate. And it's up to you to figure out which form of the virus I am. We got some very smart scientists who are staying on top of that. And that's why we were able to develop the technology that we have today. And that's why we're able to do the flu shot every year. But that's actually the nature of a virus. And so I would not be surprised if we find ourselves doing the same thing that we do with the flu vaccine, where you may need to get a booster shot every year. That's part of the nature, that's part of the natural history of a lot of viruses. And so staying on top of getting the community vaccinated is incredibly important for that reason. But I don't want you to be dissuaded or disappointed by the possibility that we may need to get additional boosters. We're still in the middle of this battle with the virus. And so I would anticipate booster shots.
Just before we came on live, CNN had showed the results of a survey or a poll they had done. And there are still segments of our people in the world that are saying they'd rather get the virus than get the vaccine. What do you say to that?
Well, I think everybody has to make an individual choice. And I know Dr. Davis and Dr. Price here would speak very cautiously in terms of getting the vaccination. It's an individual choice. Nobody's telling someone thou must do so. But again, if you go and Google those countries, minus Brazil and India, you're going to see the type of misery that this virus can inflict on a society. We in America are actually very blessed that we have 3 vaccines: the mRNA vaccines, Moderna, Pfizer, BioNTech, and the Johnson & Johnson adenovirus platform. So we're not having that same level of misery. But if we don't curtail this virus, it's not going to just go away. It's going to continue to find people to infect, people to hospitalize, and people to kill.
I would agree. And just to emphasize the importance of us continuing to provide facts in ways that we can, like we're doing tonight, in our individual circles, because there has become a sense of complacency in thinking that because we aren't seeing the same level of mortality or death that we were a year ago, that I would rather just get the virus because maybe I'll just be sick, almost like flipping a coin in determining whether or not you will be ill. We really have to continue to share facts, and most importantly, make sure that our community members understand, while I may only have mild illness because maybe I don't have certain underlying conditions that put me at increased risk. I could potentially be spreading it to my loved ones, my mother, my father, my grandparents, my godmother, those who I love who will get sicker and could potentially succumb. And so we continue to share this message that it really does require us, as Dr. Ferdinand said, to be hyper vigilant about what our community could look like if we start to ignore this virus.
Absolutely. Part of our work of the task force has been to monitor health disparity and health equity. And early on, when the vaccines were available, there was more demand than supply. And so looking at the most recent statistics from LDH regarding the percentage of people who have been fully vaccinated in Louisiana is very, very concerning. Only 24% of our state has been fully vaccinated. So the demographics of this 24% that's been vaccinated, 61% are white and 27% are Black. So this data shows that we have a lot of work to do to reach herd immunity. It seems like our supply has exceeded demand. So when we talk about herd immunity, what exactly does that mean? And why is it so important in getting this virus under control? And anyone who wants to answer it.
Well, herd immunity doesn't mean that we're cattle. It means that the group is protected because you have so many people who have gotten vaccination. And we also include the people who got the natural infection, although I've already made the case that I don't think the natural infection protects you as well as the vaccine. But you take that percentage of people who've gotten the vaccination, let's say we get up to 40% or 50%, and then you take the number of persons who've had natural infection, you add that to the vaccination. So let's say we get 50% plus 20%, 70% of the people then, at least for a year to several months, are going to be protected against getting COVID-19. So when the coronavirus goes through the population that's looking for a host, it wants some person that it wants to latch on. So as you said, Dr. Brown, it can live. It can't find anybody because so many people have been vaccinated, plus the other people who have natural immunity, although the natural immunity may not last as well as the vaccination. The problem is that the numbers have come down, but if you really look at those graphs, we still have a lot of virus out there. And if we stop now and just party hardy and have a good time, the virus is going to have a good time also.
On a national level, President Biden has set a goal for us to be at 70% herd immunity by July 4th. Right now, nationally, I think we're at 50%. That's a lofty goal, but it's one that he is empowering and entrusting our state to reach. So we really have a lot of work to do. We recently learned or have heard about the governor relaxing some rules as it relates to masks and wearing a mask. And again, some people are confused as to whether they should wear a mask after being vaccinated or should they not wear a mask after being vaccinated. So from a health professional perspective, what would be your advice to individuals who have been vaccinated asking whether they should wear a mask or not?
I think it's important for us to remember that none of the vaccinations are 100% effective at preventing you from contracting COVID-19. So even at 94 to 95%, which is the efficacy for Pfizer and Moderna, you still have a percentage of those of us who are fully vaccinated that could potentially contract COVID and spread it to others. So if you are, my recommendation is to follow the data and the science that if you are fully vaccinated, but you are in close contact with individuals who are not vaccinated or unknown to you to be vaccinated, whether that's in a public space or not, that you continue to wear a mask. If you're in your household, everybody is vaccinated, that then the CDC has recommended that you can be without a mask, or if you are outdoors, you can be without a mask. But I really, really encourage everybody who is with us tonight and our community members to be hyper vigilant because we do have these circulating variants that we are unsure of. The science is not proven yet to say that we cannot contract COVID-19 with those variants. So far, the vaccines that have been approved by the CDC and FDA have been effective. But in order to protect yourself fully, you should still follow the public health recommendations, wear your mask, socially distance, wash your hands often.
And to add to that, one thing that I will say about wearing the mask is that I am my brother's keeper. So the biggest thing that Dr. Davis said was, although it may be effective at keeping us from getting ill, we don't know enough in terms of whether or not there's a period of time, how fast our body fights against it if we're exposed. And is there a possibility that we could expose someone else? With all of the uncertainty in the ongoing studies, they're following the study participants for 2 years. I feel personally a responsibility to continue to wear that mask. More so, not because I'm concerned about myself, but because of a sense of community and my responsibility to the community. And to make sure that everything that I'm doing, number one, is compliant with the public health advisors, with the CDC, and two, to protect those people who have not yet been vaccinated, because I have no clue who I'm walking past. And it's important to think about the community and to think about others in this process. And that's a big reason why I was vaccinated in the first place. So if anyone asks you about the mask, my response is, I'm my brother's keeper. That's why I'm wearing it. If you want to know the technical recommendations from the CDC, if you go to the website, they actually have a red, yellow, green poster that gives you recommendations based on whether or not you're fully vaccinated versus not fully vaccinated. And again, fully vaccinated means you've gotten 2 shots from Moderna or Pfizer, 1 shot for J&J.
And waited the 2 weeks, as
That's
Dr.
right.
Bryce Haywood had told us before. And that's important to keep reminding folks, right? Because if you have received a single dose of a 2-dose series, you are not fully vaccinated. If you received those 2 doses, you still need 2 weeks after to really have full immunity, and the same for the single dose. So it's important for us to remind everybody of the time periods and time frames that it takes to be fully vaccinated.
So the take-home message regarding the mask is, I wear my mask for you, please wear your mask for me. It's the humanitarian thing to do. We have heard that the message regarding the vaccine is just as important as the messenger. And so we've also, research has shown that our trusted voices that people listen to are family members, physicians and healthcare providers and nurse practitioners, clergy, faith-based. So these are considered some of the trusted voices, as well as our HBCUs. And that is why this was important for us to launch this vaccine campaign. The Tuskegee study, that left a terrible stain on the souls of our nation. And so when we talk about trusted voices, who are people most likely to listen to? And public health begins with public trust. So where should the message come from?
I think you've already shown who the message should come from. It should come from you. It should come from the nurses and the nurse practitioners, who are perhaps the most respected health practitioners. It should come from the doctors, who are also widely respected. In the Black community especially, our ministerial alliances, All of those have now come together. They have Zoom meetings just like this, and I've spoken to several of them. They become trusted messengers. So it doesn't necessarily have to be a national figure, doesn't have to be an athlete or some superstar. It's people who are in the community, who have worked for the community for decades prior to this pandemic, who have looked at the science, who have hopefully been vaccinated themselves, I have, who then go forth and give the best data they can so that the person makes the individual choice. Nobody's being forced. One of the things I did want to talk about, Dr. Brown, before we run out of time, is that for those young people who think that just because they're young, they won't be hospitalized, they won't have death, that's not true. Young people, if you look at Michigan, it's a hot spot, it's cooling off a little bit now. Most of the hospitalizations are being found in people under the age of 50. The other thing is, even if you're not hospitalized, even if you don't die, coronavirus can make you really sick. There are people now who have what they call long haulers, L-O-N-G haulers, like hauling a truck, where for weeks and months after they have coronavirus infection, COVID-19 is the name of the infection, they're tired, they're short of breath, they can't smell, they can't taste. So this thing will wear you out, even if it doesn't cause hospitalization and death. Plus, our biggest message is that even if you're not very sick, you can pass it on to an older person, someone with diabetes, hypertension, heart disease, kidney disease, and asthma, sickle cell disease, and you can kill someone else. So we are all our brothers and our sisters' keepers. Do it for yourself because you don't want to be sick, but also do it for others.
Well said, Dr. Ferdinand. Well said. We all have a responsibility to communicate the message. You all talked a little bit about the variants. You know that there are variants now in the state of Louisiana. Are the vaccines safe against fighting the variants?
Thus far, the data looks good. The antibody levels of the vaccines that we have are very high. The variants are a little bit more difficult to kill. They tend to transmit disease easier. We don't know if they really are more malignant in terms of a virus, but they're easy to transfer. But the vaccines we have now do kill the variants.
Right.
Thus far, we're simple human beings with simple tools. We can't predict tomorrow, but thus far seems to be killing the variants.
And my last question before we open it up for questions in our chat and questions that have been submitted. For our college students who are listening in, you heard from our esteemed SGA president that, you know, he got the vaccine and he's sharing the message. If you could tell our college students one thing, anything, why is it important that they get vaccinated?
So I think it goes back to doing it for their loved ones, if not for themselves, doing it for the people they love. And as Mr. Taylor Jarrell stated before, if they want to get back to the normalcy of Jaguar Nation, then they're going to need to be vaccinated. We have all had a very challenging year plus of being virtual, hybrid, as far from normal as we could be. And if we want to get back to any normalcy, then they need to get vaccinated, but most importantly, to protect their loved ones, if not themselves.
Well, we are in this together. We have to get out of it together. And if you know anything about us Jaguars, we don't give up and we don't give in. So at this point, I will turn it over to Dr. Gilmore. And if he wishes to communicate any of the questions that we have in the chat box or any questions that we've received that the panelists haven't already addressed. Dr.
Thank
Gilmore.
you so much. Thank you so much. And thank you, panelists, for a fantastic discussion and factual information. Please, to our guests who are participating, if you have any questions, we invite you now to post those questions in the chat. I'll be glad to direct those to Dr. Brown and she can and our panelists. But feel free to please feel free to ask any questions, because the goal is to empower and to inform and to educate so that we all can go out and ensure that others are vaccinated and answer questions and dispel any myths. So please feel free to post any questions. We've covered basically every question that I've ever been asked tonight, but there may be others out there. Someone says, as it relates to potential side effects, would it be a good tool to review how family members were affected when vaccinated to determine which vaccine to receive?
Well, all of the vaccines are very well tolerated. You do have side effects, but the side effects are not complications. The main side effect is that when you get vaccinated, the next day or so, you may have tiredness, you may even have a low-grade fever, your arm may hurt, you may even feel a little headache. But that's not really a complication. What's happening is you're making the spike proteins, those things that are sticking out of the coronavirus. So your body thinks that you got coronavirus, as has been told to you earlier by Dr. Davis. There's no live vaccine. But your body then mounts an immune response and sends in the cavalry to attack those spikes that you've made. So you do feel a little something. It may last a day or two or three, but overwhelmingly, the vaccines have been shown to be very safe. And when you hear about a tweet or an Instagram post or a Facebook post that such and such had some terrible, terrible side effect, let's remember that 200 million people have gotten at least one dose of the vaccine. If this was something that was very, very common, you wouldn't need to have it on Facebook. You wouldn't need to have an Instagram or a tweet. There would be people laying out in the street having complications, and it's just not happening. The side effect that you saw with the Johnson & Johnson vaccine was very, very rare, difficult to predict. It's something that may be unique to that vaccine because of the adenovirus vector that's used in order to get the DNA into the body. And it's found mainly in younger women, 18 to 49, although it can happen in anyone. And it's something that we really, really can't predict is going to happen. It's probably no more than 1 to 2 out of a million. The mRNA vaccines, Moderna and Pfizer, have not shown that because they don't have an adenovirus. And in fact, there's nothing in it. There's no mercury, there's no silver, there's no microchip. It's just basic nucleic acids with a lipid capsule, a little salt water, and that's about it. And there is no vaccine in your body. Those of us who have had an mRNA vaccine, there's nothing to test because those nucleic acids are broken down in about a day or two, no more than 3 to 4 days. It's gone. What you do have, though, is an immune system so that when the real coronavirus comes on the scene, it can kill it.
Dr. Ferdinand, I received via email and following up to what you're speaking about, as well as in the chat. You talk about those short-term effects. Are there a couple of questions that are related to what are the possible long-term effects? A lot of folks, especially in our community, are worried about a year from now, 2 years from now. What can you say or give us the confidence to not worry about those long-term effects?
First of all, again, we're a simple human being with simple tools. We can't predict tomorrow. That being said, there is no vaccine in my body. The vaccine itself, once you give it, it's dissolved. All you have now is the immune response, and almost all the complications, even the clots that were seen with the Johnson & Johnson vaccine, are found within 5 days to 28 days. I had my vaccine early on in December. I feel fine. I expect nothing. Zero is going to happen from this point. There is no vaccine that's circulating. There's nothing. There's no mercury. There's no untoward adjuvant or added thing into the vaccine that's going to come up and cause some kind of disease. So if you look again, 200 million people, 100 million have had full vaccination in the United States. We don't see hundreds and thousands of people who are having complications. What we do see is 580,000 people who have died and hundreds and thousands of people who have been crippled by coronavirus. Google Manus, Brazil, MANUAS, Brazil, and Google India. Look at the pictures and look what happens if the coronavirus is not curtailed in the society.
Dr. Gilmore, I was just going to add to Dr. Ferdinand's response that it's also important for us to remind everyone that the reason why we had the pause with the Johnson & Johnson vaccine is that our safety monitoring systems are working. We do have a vaccine adverse event reporting system that allows providers across the country to report if there are these events that are occurring, so that we would be able to identify as we continue to vaccinate if there is another rare event, but that these systems are in place so that as we vaccinate more and more of our community members, we can identify those rare events that are unpredictable. But as Dr. Ferdinand stated, what we do know is not only that 580,000 people have died from COVID, but we also know those long-term long haulers are a real thing with COVID-19. And we're continuing to study not just the respiratory impacts to COVID, but the neurological impacts that we're seeing with long-term COVID vaccine effects. So we are learning about this vaccine as we go, but those safety monitoring systems are in place and are working.
You meant long-term COVID-19 effects.
COVID-19, yes, yeah. Not vaccine.
There are no long-term vaccine effects. The people who have been vaccinated for months now are doing fine.
But it is important for us to note when the question was about, should you look at family members and the way they react to the vaccine, as Dr. Ferdinand stated, those side effects vary from individual to individual, but we should make sure that everybody has an expectation that you might have a mild side effect. Most people recover within 24 to 48 hours and are doing fine.
Excellent responses. I mean, you've enlightened me and educated me, and Dr. Ferdinand, as well as Dr. Davis, you may have to repeat what you just said because the questions about side effects and long-term effects are rolling in. And I'm going to combine a few. Someone asked about infertility. How do we know? Could that be a side effect? Stroke, sepsis, especially, are there any side effects that you see trending in African Americans, long-term effects or short-term effects, infertility in both young men and women? Do you want to emphasize one more time or talk about these concerns that are posted in the chat box and an email about long-term and short-term effects of these vaccines?
The Association of Obstetricians and Gynecologists, the specialists who take care of pregnant women, recommend that even if you're pregnant, you get the vaccine because you protect yourself. The antibodies are given to the baby. If you're breastfeeding, the antibodies comes out in the breast milk and you protect the baby. Pregnant women were not entered into the trials, but in the trials, about 30,000 women subsequently became pregnant, and they had no evidence of any fertility problem or complications related to getting the vaccine. This is the specialty organization. I'm a cardiologist. The specialists who deal with OBGYN recommend that women who are pregnant, women who are childbearing age, get the vaccine. Because the Johnson & Johnson clotting was seen in young women, there may be a personal choice to do the mRNA versus Johnson & Johnson. That's an individual choice. But even the clotting was seen within 5 to 28 days. There's no one who had the vaccine and then all of a sudden, 2, 3, 4, 5 months later, some monster jumps out in your body and happens. Nothing has happened like that. 100 million people fully vaccinated, 200 million have gotten at least one shot. Let's think clearly. If that was really the bad case, you wouldn't have to seek it out on Facebook. It would be quite evident in our community. And Black people don't have any more complications than anyone else. And in fact, those of you who are really close to the community, you know, when it first came out, we said that Black people don't get coronavirus, and that didn't turn out to be true.
Thank you. Panelists, any other panelists would like to share any information related to these long-term effects and even someone posted causes of death. Has there been any research or any instances that you can speak of where the vaccines may have led to causes of death?
Well, the Johnson & Johnson, if you get a very bad blood clot and it's not treated appropriately, with the mRNAs, they have been uniquely very safe, probably some of the safest vaccines that we've ever had. What people often will point to is an older person like Hank Aaron, who got the vaccine and 2 weeks later he died. But again, let's think clearly. If you're looking at people in their 70s and 80s, out of 1 million people, 200 to 300 of them die every week, totally unrelated to the vaccine. That was 2 years ago, 3 years ago, 5 years from now. Death is a natural part of life. A child is born, a child dies. If the person then had a vaccine and a week later, 2 weeks later dies, that's not causality. That could be just having something happen to a person totally unrelated to the vaccine. Anyone who's gotten the vaccine should be monitored. That's what Dr. Davis, and she may want to speak more about that monitoring system, because I know she runs a hospital and they tell people, I got the shot at her hospital, by the way, they tell people to sign up for that monitoring system, but the monitoring system has just not shown any long-term complications from the vaccination itself.
Yeah, that's correct. So I do want to just reiterate that again, and that's not unique to New Orleans East Hospital. That system is being used all across the country and was in place prior to the COVID-19 vaccines. It's our vaccine adverse event reporting system, so that if you receive a vaccination, even in your doctor's office, at a hospital, on a mobile unit, you are encouraged to sign up for it. But also, if you come into your doctor's office or you call saying that you're experiencing these symptoms, then those reports are made. And that's how we identify if there are rare instances associated with the vaccine, within what number of days, and it starts an investigation. So as we've stated many times, there is no evidence of long-term effects related to the COVID-19 vaccines that have been reported. And as Dr. Ferdinand stated, outside of the Johnson & Johnson rare blood clotting issues, there have been no deaths associated with causality to the vaccines.
Okay, and this will be the final question related to children. Could you give the ages, because sometimes that gets confusing as it relates to what age. I think we're at 16 right now, but maybe there is a study or research being done for, those younger. Could you tell us where we are as it relates to, especially parents who are having to make this decision for their kids for vaccines?
So I can answer that one. So for the Pfizer vaccine, as of right now, the one that's approved, it starts at age 16 eligibility. The other vaccines are age 18. As was just announced, I think it was today or yesterday, the Pfizer vaccine was probably going to get emergency use authorization for age 12 to 15. They're anticipating by next week. They've been conducting those trials the entire time. So we anticipate that in the future, starting next week, once that approval comes through, that we may go all the way down to the age of 12 for the Pfizer vaccine specifically. The other vaccines have not submitted information to the FDA with regards to less than 18. So for Moderna, J&J, definitely right now 18. Pfizer, currently 16. We anticipate going down to age 12.
Thank you so much. Dr. Merrick, I'll turn it back over to you.
Thank you, Dr. Gilmore, and thank you to our panel. I've just got to say, Dr. Brown, you said earlier in your comments, I think I captured it correctly, public health begins with public trust. I jotted that down. I hope I have it correct, because I'm going to use that again to understand that these things are inextricably tied, and we certainly want to be a part of the public trust side such that we can improve our public health outcomes. So thank you again. I must say to our panel and our audience, You have both inspired us this evening. I'm inspired by certainly the knowledge and content that's been shared by our panel, and then also the questions that have been supplied by our audience and your attention and being with us this evening. So thank you for that. So much so that we're going to, on tomorrow, send out an email to all of those who have joined us this evening, and some of those who weren't able to join, who did register in advance. We will have this recording of tonight's session for you to watch again in case you missed something. We want you to be able to watch it again and share it with your friends and family. Short hour presentation, something you can just pop in and pop out very quickly. So we will have that to you all tomorrow. And thank you for, that's another reason the registration was important, such that we could have your email address and we can send that to you. I definitely also want to thank all of our partners. I see several of them on this evening. Our alumni president, Ms. Laquita Thomas out of Dallas, Texas. She serves as the national president of the Alumni Federation. Thank you for being here with the 80+ chapters of the alumni that support this initiative with us. I see, and I hate to start calling names, but Reverend Gerard Robinson is here. He's one of the lead partners in our faith-based initiative that is tied to this work. And so thank you, Reverend Robinson, for being here, Pastor Robinson tonight for being here with us. I want to direct you also to our website. It's www.sus.edu/vaccinate. We're going to post this on the this webinar on that website as well. And you can check in to that website to learn about our next steps and more information as we continue this work and this initiative. We want to keep our public informed of what we're doing. And certainly if you have ideas you'd like to share with us, you can email us at vaccinate@sus.edu, and we can drop all of that in the chat box right now. I think some of it is being dropped in the chat box. So you can ask questions. If we didn't get to your question tonight, please email us and we will try to respond, because we're really hoping that the work that we're doing and something that was said or done here this evening will has encouraged you, or at least given you a higher level of comfort if you have not received the vaccination yet, any one of the 3 vaccinations that are out, vaccines rather, that are out there. And we do want you to get vaccinated. So we hope that, again, something that was said or done will help you in that effort. And if not, we will continue to work. This is a long-term project for us. It's not something that we will do quickly and end. As you heard earlier, our next steps are to move into our rural communities. I think we've done a great job in our urban areas, and next up is up to our rural areas. So stay tuned at our website for more information, and we will keep you informed via our email address and the emails that we will send you. Again, thank you everyone for joining us, and you'll hear from us tomorrow.
Thank you.
Thanks everyone, and have a very good night.